you to all picture the way you look. And now imagine if you were standing in front of a mirror. Basically what you just saw, your reflection would be identical to what you thought of because most people have a decent body perception. Now imagine if you look like this and every time you thought of yourself or looked in the mirror you saw that. That's what every day is like for someone who suffers from anorexia. Anorexia nervosa is a severe mental pathological disease that if untreated for long enough, fatality is almost certain. And over the past 25 years, anorexia has increased by 75%, and I feel like it's important to educate people on this increasing disease to try to decrease these growing numbers. Today I'll be discussing two aspects of anorexia. First, the causes, and second, the treatment. Let's get started with the causes. According to executive functions in anorexia nervosa, the specific pathophysiology of anorexia is not completely known, taking into account that there are different factors that seem to be involved. The possibility that there is a dysfunction in the central nervous system has been explored in many different ways. One of those ways is the assessment of the relationship between the cognitive process and certain eating behaviors. When therapists sat down with their patients, they were able to talk about different food situations, and those patients were able to label and identify those emotions with those situations. Another way is the cognitive process of how society affects the way that we think. And from early on, we're taught that looks matter, and it is true. Our society, we are judged on the way that we look, but there's a line between looking professional and then trying to conform to what society thinks beauty is. And I can see it with the girls that I babysit. They're 7 and 9 years old, and they're worried about getting acne and getting fat when they get older, and they shouldn't be worrying about that. They're children. They should be carefree. According to mirror.org, with an increased population of children who spend a lot of time in front of the television, more and more are coming up with a superficial sense of who they are. According to new insights and neurocircuit functions of anorexia nervosa, common behaviors for anorexia patients are anxiety and depression, and when they don't eat, it relieves this anxiety for them, so it's kind of like a reward for them to keep starving themselves. Whereas eating promotes these dysphoric moods and this extreme intense anxiety. According to family functioning in anorexia nervosa, drug dependency disorders, several findings show that drug dependence and anorexia share common processes regarding loss of control, repetitive and compulsive actions. The level of cohesion and interpersonal dependence within the family suggests this connection. Because 50% of anorexia is genetic, not saying that the parents were anorexic, but they had those addictive personalities within their family. And most patients say when they feel like they're losing control, it's because nothing in their life they can control, so what they're putting in their body is something that they have control over. And people with drug dependencies, there are a lot of different reasons why people turn to drugs, but they're trying to control something as well and then turning to self-medicating. Family functioning affects anorexia. I have a friend who's recovering from anorexia, and she has a lot of family issues, and her brother was involved with drugs, and her anxiety from her brother's condition kind of changed into her food anxiety and then just kind of built up by there, and then she became anorexic. And patients who have this really intense family situation should probably be in a hospital or a rehabilitation center, because these triggers of these family problems can make the condition a lot worse. So now that I've talked about the causes, let's discuss some treatment options for in and out patients. The refeeding treatment can be dangerous. According to safe refeeding management of anorexia nervosa in patients, at admission, all patients with anorexia sign a contract including an individually tailored multimodal treatment program. There are 3 stages to this program, and the first stage is the refeeding stage. The refeeding stage is just the balancing of nutrients throughout the body when the deficiencies were occurring. The second stage is motivation and objective setting, which basically just keeps the patients on track and keeps them motivated throughout their treatment progress. And the third stage is personal responsibility and sense of self. And This is the most important stage because even though this disease affects the physical being, it's all mental, and you really need to be in the right mental state or you're going to wind up, being back where you were and just kind of like focusing on yourself and food. This is someone who's going through treatment for anorexia. When refeeding, many complications may arise. According to my aforementioned source, refeeding syndrome is characterized by the occurrence of thiamine deficiencies in fluid and electrolyte shifts. There is a high risk of further cellular damage because of these electrolyte shifts. Symptoms include severe malnutrition and overaggressive nutritional support in early stages without adequate supplementation of micronutrients. And basically what that means is that if you were to put these nutrients back into this patient's body, they were malnourished for so long that they can have congestive heart failure and their organs can start to fail and they can actually die from it. So it's really dangerous and it's a very slow process. According to the MOSAIC study, Specialist Supportive Clinical Management, also known as SSCM, is a type of treatment for anorexia nervosa outpatients. The first step is clinician assessment just to make sure that these patients are actually qualified and that anorexia is what they are going through. It's not some other cause of why they're not eating. After that, there are 10 therapy sessions with 3-month assessment. After that, there is another 10 therapy sessions with a 6-month assessment. According to my aforementioned source, the body mass index, if it is less than or equal to 15%, then there will be 10 additional therapy sessions with an assessment for 4 months and then a final annual 12-month review. And this is someone before and after who went through that treatment. So today, like I said, this disease is extremely, extremely dangerous, especially when untreated. And today I talked about 2 aspects of this disease, the causes and the treatments. And I have seen what this disease has done to people that I love, and I want nothing more than to promote a powerful sense of self. And hopefully you'll leave here with that message today and pass it on.